Thank you, Governor Sakaja. We must appreciate that that was the right person to speak today on behalf of the governors, because we all live in Nairobi and we're in Nairobi. Your Excellency, the First Lady, the Cabinet Secretary for Health, Adan Duale, my colleague governors, and our protocols observed. I may not have much to say, just to appreciate that the last 4 years has been a journey that Kenya needed. We started with the reforms that we had with the 4 laws that were passed, which has been the brainchild of the Kenya Kwanza government and the leadership of His Excellency the President. Those 4 laws brought the reform that we needed today to bring us to where we are. I cannot figure out a country without SHA. I cannot figure out a country without the CHPs that we have today. The awareness that we are talking about today, which started much earlier in a smaller fashion by the counties in form of MPDSR, has been nationalized and coordinated. The effort of both the national and the county government that brings the synergy to ensure that mothers don't lose lives or even lose the newborns is critical and is a product of that synergy that we have between the levels of government. The health sector would not have been at a better place today if we do not have the coordination that we have, that has brought together all the health workers, irrespective of the space they occupy, whether it is CHP, whether it is a specialist in the ward and in the theaters. That has been very critical to ensure that all Kenyans are board in what we are striving to achieve as universal health care for everyone in Kenya. We want to make a commitment as the Council of Governors with my colleagues. Initially, health used to receive more or less the same equal funding with the other sectors in the devolved units. But today, every county spends or allocates approximately 60% of its total budget to health. And that tells you that in all the devolved functions that we gave the devolved units, health is at the top. It is at the summit. It is of critical importance because without that health, then all the other functions cannot be able to be performed. I do not want to overrate because it's not my day, but I want to make that commitment, Daktari Duale, that as we call you today, we are going to work with you to make sure that the coordinated effort that the ministry has already been able to initiate with us will realize the results that the Kenyans deserve. With those few remarks, I would like to take this opportunity to ask the chair of, with your permission, First Lady, the chair of health, to make just one remark, or just make a remark.